Let's chat.
For the past 6 months, obviously, we have been dealing with the pandemic, COVID-19. Well, right around the corner, we've got flu season that's going to be knocking on the door. And Sharon Goforth is here with the Hamilton County Health Department to help us make a little bit of sense about differentiating between the two. Sharon Goforth, good morning.
Good morning. How are you today?
I'm doing quite well, thank you. A lot of people are hesitant under the best of times to get a flu vaccine. Is it important this year for those people and the rest of us to make sure that we are vaccinated quickly and promptly?
Even more important this year, and you're right, a lot of people are always hesitant to have that vaccine done, but on the heels of still having COVID in the United States, and with the flu symptoms mimicking COVID symptoms, if you get your flu shot, do your best to protect yourself against flu. That's one thing off your mind, because once again, the symptoms are pretty much exactly the same.
I think one thing this pandemic has taught us is that everyone's an expert when it comes to COVID, and everyone's got an opinion, and theirs is always right. But having said that, I want to ask you, is it possible for folks to get COVID and the flu at the same time?
It's absolutely possible to get COVID and the flu at the same time. These are two separate and distinct viruses. And once again, you don't ever want that double whammy kind of thing going on. Even though the symptoms are going to be similar, you still have two separate viruses attacking your body simultaneously. That's never a good idea.
Why do you think so many people are hesitant to get the flu vaccine, which has been around for decades?
Well, I don't honestly have a good answer for you, because you're right, it's been around for decades. We know that it works very well. Most people have little or no side effects from the vaccine. So a lot of people, I think it's still they just don't like to get shots, period. I don't know that it's necessarily flu, they just don't like to get shots.
Well, generally speaking, from the financial point at least, your insurance company will cover the cost of a flu shot, and you folks at the Hamilton County Health Department have clinics where you can get these shots absolutely free. And if it improves your odds against getting the flu, even by a little bit, why wouldn't you do it?
I agree totally. And once again, even in years when we haven't necessarily had a good match with the vaccine and whatever virus strains are circulating, it's still your best bet. And once again, any improvement, even if it's a little bit, why would you not take that improvement?
Exactly.
And it's just a shot.
Who is in the higher risk category that definitely should get a flu vaccine?
Well, we automatically recommend 6 months and older, but when we're talking about high risk, our older adults, 65 and older, anyone with a chronic medical condition, anyone who has a heart condition, lung, kidney, renal, anything that's already compromising their immune system, we want to make sure that we protect them to the best of our ability.
And that in turn not only helps protect the patient against getting the flu, I would think it also kind of stops you from passing that flu along to someone else.
That's absolutely correct. So once again, if you have someone who for whatever reason can't get flu vaccine, because we know some people are allergic to some of the components, please do your due diligence and make sure that you're protecting yourself so that you don't take it into them, and especially once again looking at those high risk groups.
All right.
65 and older chronic medical.
Sharon, very quickly, when should we get the vaccine?
Right now, as soon as possible. It's already, it's the middle of September. If you have the opportunity, go ahead and do it. If you normally wait until a little bit longer, that's okay too. We recommend talking to your medical provider, see what they recommend.
Right.
Or one of the local pharmacies. If you have a pharmacy you normally use, call and talk with one of their pharmacists, and if they've got it and it's a good time for you, go ahead and go and get it.
Sharon, thank you very, very much. And remember, Sharon, everyone's an expert and their opinion is always right. Get the vaccine. Do yourself a favor. Find out more by checking out the Hamilton County Health Department website, health.hamiltontn.org.